Hello, thank you for tuning in to A Healthier Me. I am your host, Michelle Wakem, and joining me on the show today is June Thomas. She is a medication reconciliation coordinator and a pharmacy reimbursement coordinator. It's a mouthful, but I got it. So let me introduce June Thomas. June, thank you for joining me on the show.
Thank you.
And before we get into the programs that you teach, could you please tell us a little bit about yourself and your background?
Sure. I am a medication reconciliation pharmacy coordinator specialist, billing specialist. I work for a small hospital in Brunswick, Parkview, and I make special IVs. I do chemotherapy, and I do a lot of billing audits for our pharmacy department to make sure we're profitable. And I also speak with patients that come into the hospital and kind of check out what their home medication list is and making sure that we have that correct in our system so the physicians can kind of guide their care correctly. Are they taking their medications? Should they be on something else? And that link is very important as far as making sure patients don't get readmitted and stuff like that.
Okay, wonderful. And talking to you prior, you've said you've been doing this for quite some time, and I didn't realize that a pharmaceutical technician is such a broad term because there's so many areas that you could concentrate on when becoming a pharmaceutical technician. And can you tell us what those areas are?
Well, I started off at Hannaford Brothers, part-time in a pharmacy, and I was just filling prescriptions, waiting on customers, a lot of data entry, or just counting, and slowly it's increased to I was a support person, so you can do support. Hospital pharmacy is a little different, where you're making IVs, less patient contact. I talked about reimbursement, sometimes just that knowledge of pharmacy and medications and patients and stuff like that helps for reimbursement. So you can do reimbursement, IT as far as everything's computerized, so there's programs out there. And again, that knowledge of medical terminologies and things like that, you can go into that field. And if you like the assembly line, there's that assembly line kind of feeling when you go into like home health, when they ship out medications to nursing homes and stuff like that. So it does have a big variety, and I've had a great experience in the pharmacy world, so I've kind of experienced a lot of it.
Touched upon
I
each
have.
one. And what's the one that you found that suits you, that you enjoy doing the most?
I like what I'm doing now because I get that one-on-one with patients when I go and talk about their home medications, or if they need assistance in their prescriptions or infusions for chemotherapy, I can talk one-on-one with them. But I also go into an office where I do a lot of background investigation and auditing and stuff like that. And I work with physicians and nurses, and so I kind of get a touch of everything. So I kind of like that.
And it's nice that you can take it and kind of see what area,
Exactly.
what's going to suit you the best and what you feel works better for you, and vice versa, which is nice.
It's very nice, yeah.
You can have the option of trying different things. So to become a pharmacy technician, what are some of the requirements to do so?
Well, you can. I did not have any experience, so you can work part-time and hopefully get hired on, and there's no requirements to be certified in the state of Maine as of yet.
Okay.
But I do teach a program that kind of helps you understand the different aspects of being a pharmacy technician, and can also guide you in getting you ready for that national exam if that's what you want to do. And I think employers kind of look at that as you really are invested in wanting to learn and to do this, and you're not just taking this as a carefree position. You really want to invest your time into it and care about what you do.
Absolutely. I know you mentioned the program that you teach. Can you touch upon a little bit what goes on in your classroom?
Yep. It's an adult ed program,
Okay.
so it's offered 2 days a week, and it's for about, let's say, like 6:30 to 9:30. It's like those kind of hours. I tend to try to keep it on the later end, just because I do work full time and I do this after work. It runs for about 7 weeks, and it goes along with the school's schedule, so if they have school break and things like that. But it's generally a small group of people, adults usually. You have to be a high school graduate
Okay.
or have a GED. And it goes into each step of pharmacy technicians, from what pharmacy began, how it began, to different types of pills, recognizing them, different terminology, because those things you'll need to know when you go to fill a prescription.
Absolutely.
So I kind of touch on the book and the guidance on that, and then I give a lot of my own experience on what's really important to remember, and you really need to know it for the exam. And in the work field, pharmacists really appreciate that you know that, or that you've made that effort into kind of remembering those things.
Absolutely. And I'm sure it plays a huge role to remember the names and what they are, what they do. I mean, it's important.
Yeah, there's little tricks, and some of them I can't remember as well, but just little tricks, and pharmacists love to help, so they love to teach you and stuff like that. But
like little acronyms.
Yeah, yeah. The brand names tend to be a little bit more easier to remember, and they'll kind of give you guidance on what they mean. And generic, or the chemical name, because you'll see a bunch of the same drugs that are kind of looking the same, but there's different brand names for it.
Okay.
But yeah, it's just a way of touching on each one of them.
That's great, and like you said, you've had the opportunity to experience a lot of these areas in the pharmaceutical field. So being able to tell them, or your students, about the different areas based on your experience goes a long way too, because it's coming from someone who's been there, who's done it, and can give them the information firsthand as what to expect and what goes on.
I really like the retail end of things, because I used to really like all my customers that used to come in. But it's funny, because a lot of students that I teach don't want anything to do with that.
Oh.
And a couple of the people that I've helped place into positions, they actually went into the home health field, where there really is no patient contact. They're just in a warehouse, either filling prescriptions by typing them in, the data entry, or filling them by pills. But it's just kind of funny how, like, I did it for the retail end of it, but they like that end.
Yeah, people are different. They, to each his own, right? They like different things, different aspects.
And they're valued.
Absolutely.
Just as much as somebody that gets into retail. They are needed.
Yeah. And I'm sure, I'm sure, having that customer connection, you like the retail, then you create those relationships, and even get attached, even, to some of them too.
Yeah. And I see them, unfortunately, sometimes in the hospital. So, and they'll go, "I remember you." And so it's kind of cool to see that.
Absolutely. So what can, once they take you have your program and they go through your program, they become certified, and they've got a job, what can they expect once they're in the job and in the field, and what would be a typical day be like for a pharmaceutical technician?
So in the retail world, because that's most of mine, well, I could probably give some of mine, but mainly it's, I think it's in both fields, both retail and hospital. You come in and there's that overnight where either you're filling to get things caught up for the day. So generally, if it's retail, there's patients that are coming in, they're dropping off their prescriptions, or they've called them in, and you'll be filling prescriptions by either a label and pulling the drug, counting it out, and a pharmacist is always your last check. So in hospital, you'll be filling what they have is a Pyxis machine, which dispenses out all the meds for nursing. But as you pull all the information and pull all the drugs to go out to those Pyxis machines, a pharmacist will check it off, and then you'll go fill the machine. So you always have that guidance. So hopefully there's never ever a mistake. There's several eyes checking it and things like that. So you go through filling, you're waiting on customers, or for me, waiting on nursing and stuff like that, getting what they need. Sometimes it's calling insurance companies, thing isn't covered, answering questions for patients as far as copays and things like that. As far as drugs are concerned, you can't answer those questions. Those are for a pharmacist, which it kind of is. You might know the answer, but it's much easier just to let the pharmacist handle it. It's their license. You're working under them. So it's kind of that happy medium, I think.
Yeah, absolutely.
Let them do that part of it. But it's a very rewarding. I
would think it would be, absolutely.
I had 3 young children, so it was a great career for me. They were very flexible with hours, and I worked in my own hometown, so I was able to take care of my kids. When needed, I was close by, and I had that flexibility.
That's wonderful.
Yeah.
And those are all great, working moms looking to work toward a better career.
Right. Even if it's part-time.
Even if it's part-time, and it's just to get their foot in the door, because you say there's room to grow in this field.
Right.
So that's a great way to get their foot in the door. And the hours that you hold your classes, I think it's really great because it'll allow for those, single moms or working parents that don't have the time during the day to take those morning classes or afternoon classes. Those hours are perfect.
Right. And I'm there if you had questions on how to do some of the math. Sometimes the math is a little intimidating, but if you just, I used to remember a formula and I would just kind of repeat it. And when I took my national exam, I wrote it on the top of my paper because I could always refer back to it. But it was the easiest way to get through that exam. And once you're certified, you're required every 2 years to kind of do 20 hours of continuing credit, educational credit, and that you can kind of pick different medications or disease states or whatever that's out there and kind of learn about it, take a little test, and then you get credit, like 1 or 2 credits.
Oh, wow.
A lot of employers will pay for it. A lot of employers offer those continuing educations for free, so it's not like it's a cost to you there.
Oh, okay. So that's a big benefit, actually.
Right.
Yeah.
And you're continually learning about new meds that are coming out or new disease states and how they're handling those.
And it's constantly changing.
Constantly, yeah.
So it's a forever learning in this field because there's always a new drug or they're pulling something.
They're pulling things out. Or the other thing is that, this probably say how old I am, but there never used to be advertising for medications. And now there's advertising. So you go to your doctor and you go, I want to go on this new drug. And
I want the purple one.
Yeah.
I want the blue one.
And they'll be like, well, you don't have anything to need that for. But anyways, no, but the advertisement is a big push in pharmacy sales and stuff like that too. So
yeah, it's
good
interesting.
need.
Yes, and are you finding that with this field that there's a growing demand for pharmaceutical technicians?
Pharmaceutical technicians that have that interest, yes.
Okay.
I don't believe, you don't always have to have the total experience as far as you had to have worked, for a couple years before you can get into it. I think that if you just show that drive that you want to do it, a lot of the positions that I've done part-time, and then they'll hire you on full-time.
Okay.
So, where I work now at the hospital, I did it per diem. And once they saw how I work and what I did and what I wanted to do, they offered me a position, and which kind of helped me get out of where I was and to do something new and a better pay and good benefits. So,
Excellent.
yeah.
Wonderful. Good for you. That's great.
Yeah.
So going back to your class that you are going to be teaching, it's at the Old Orchard Beach Adult Ed.
Yeah.
And when's your, do you know when your class is going to be ready for people to sign up?
So they only offer it in the winter.
Okay.
So it's usually February through to like the end of March. They just had a session that they didn't have enough enrollment, so they're going to offer it again next winter.
Okay.
And I encourage people to call me and ask me questions, or they can email me.
Okay.
Because again, some of them are a little intimidated, or they can't get right there at 6:30. They might not be there till 7. I think we all have an outside life, and we're all trying to make better. And I usually try to help out either way.
You'd mentioned that people are intimidated by doing something like this. A pharmaceutical technician, the word can be a little intimidating. What would you say to those people who are intimidated, who want to make that leap and try something new or change their job or what they're doing? What would you say to those people that are thinking about it, on the fence, but are just not sure?
I'd say definitely, call me. But on the other aspect, I would do it. It's been a very satisfying career for me. It's not just a job. It's something that I've invested into. Not a lot of money I've had to invest it either, but just the educational part of it, the opportunities that I've had. It's a great, satisfying job. And now that I'm teaching it, and I've had that experience both in retail and hospital, and I've seen what it's like to do home infusion, if you're not a people person, you can sit at a desk. And if you are a people person, you can be out there with them. So it's a great career. Either if you're changing it, or if you're a mother trying to bring up kids, or if you're retired, any of those kind of feels, I would encourage you to get into it, because it's been great for me.
And it shows. I mean, you talk about it and you smile and your face lights up, and so you can tell that you enjoy what you do, and it's a passion, you know.
Yes.
And it's not just a job. It's you enjoy doing what you do. And
Right.
It shows.
Thank
It shows.
Thanks.
Now the money that can be made for pharmaceutical technicians, what's for salary, or does it depend on where you are? Does it depend on your experience, where you live, the demographic? How do they determine pay for someone getting into something like this?
So probably part-time retail, you'd probably make not as much as if you were to do a per diem or overnight. Okay. Now, per diem, some people aren't sure what that term is. It really is that you're not on the schedule every day or every other day. They kind of fill you in, so you can't always be guaranteed those certain hours. But sometimes that means you're not getting the benefits, so they kind of tend to pay you a little bit more. Mm-hmm. So even if you don't have that experience, just to kind of get in, you can see your pay rate kind of go up. Mm-hmm. If you do hospital and you do nights or you do shift work, things like that, those I see can pay very well. Mm-hmm. And I've also found that places like Hannaford Brothers, and I even think like Rite Aids, they train you. So you might take this course, but they're going to have their own training aspects. So they're not going to just throw you behind the counter and have you work. Mm-hmm. They're going to have their own training process. Either you just wait on customers first before you start learning the drugs.
Right.
Just because you take the course doesn't mean you're going to be a pro at it.
Right.
You're familiar with wording and things like that.
It's just getting you ready. It's prepping you for that sort of thing.
So, and then once you become certified, a lot of employers will increase your pay as well. Because you're certified, it does help your pay rate there.
Wonderful. Okay, so there's a lot of factors that determine really. So it must be we were talking earlier, and you were talking about how you had helped place some of your students.
Yes.
And how rewarding that must be. What a
It-
great feeling. Tell us how that must have been for you, how that great feeling it must have been.
Very good.
Yeah.
I had one girl, she was working at a retail store, and she really wanted to get into the pharmacy, pharmacy tech, and she took my course and was having a hard time applying for different jobs. And I have one connection to a home infusion company, and they called me and asked me if I had any students that were interested. And I contacted her, and I helped her with her resume and kind of wrote her a letter of reference. Because I feel that if you're a student of mine and I see you work, I'd be more than happy to help you get a job. And I did that. And one other girl, I helped her get a job at May Med,
Wonderful.
and tried to get her back closer to her hometown. But she's very happy at May Med, and then she's kind of gone for different promotions within May Med, and I think that's helped her quite a bit. And
Wonderful.
I think she's a single mom, if I remember, as well. And
Great.
so it's very rewarding to see these. I think they wanted to work hard, and they accomplished the program, and they got a great job.
They achieved what they went out to do.
Yes,
So
exactly.
that's wonderful, and that says a lot too about your program.
Yeah.
Which is great. Now, does your program run only with Old Orchard Beach and Saco Adult Ed, or do you offer it through other areas as well?
They offer it through other areas. So if you look at your local adult ed, there's 2 different programs I've seen out there. The one that I teach, it generally runs around $1,000.
Okay.
And I think you can set up payment plans with the school. You just need to contact them.
Okay.
There are other ones that are a little bit more expensive, but that also includes the national exam. So in that program, you will take a national exam.
Okay.
With mine, it doesn't include it, and you can take it when you're ready. Sometimes people like to work for a little bit before they actually take the exam.
Okay.
So right now, I'm due to do a class in Bath at their adult educational program.
Okay.
And
That
hopefully that will happen in March.
In March, that one's
Yeah.
starting up in March.
Yeah.
Great. So Old Orchard, so pretty much everywhere, Bath, Old
Yeah.
Orchard, Saco.
And Wiscasset, I've done it up
Wiscasset.
there.
Okay,
Wiscasset.
I like Wiscasset. It's a nice
Yeah.
area. Yeah, I've been through there too, going
Yeah.
to another Thomas.
There you go.
I guess, is there anything else you'd like to add before we close the show?
No, it's a great program. I encourage you to call, and if you have any questions on it. And thank you.
You're welcome. Thank you so much for joining us, and good luck with your programs.
Thank you.
And it'd be great to have you back again
Yeah,
and
definitely.
talk someday. That'd be great. Thank you, June.
Thank you.
And to everyone at home for watching, thank you so much. If becoming or learning more about pharmacy technician is something of interest to you, please stay tuned. June's information will be at the end credits, and you can jot down her information. Give her a call, send her an email, check your local adult education programs. Look for her. It sounds like a wonderful thing. Thank you so much. We'll see you next time. Bye-bye.